This segment of Delmarva Life is brought to you by TidalHealth.
Cancer is an unfortunate reality that we must all deal with in one way or another, whether it affects us personally or someone close in our lives. It is ever-present nature, requires plenty of awareness and knowledge in order to combat it.
That's right, and October is Breast Cancer Awareness Month. It's a time to discuss the disease and reminding us of the importance of annual mammograms and routine self-exams. And with us today to share more is Dr. John McKnight. He is a medical oncologist with TidalHealth's Richard A. Henson Cancer Institute. Doctor, thank you so much for coming in this afternoon. Let's start off with explain the significance of breast cancer awareness for both men and women.
It's evolved over the years, and it's really intriguing. And now it's become part of every fall season. And historically and culturally, it's pretty interesting. It started in 1985. And prior to that time, in our culture, medically and socially, breast cancer was like a secret. Mm-hmm. You didn't tell anybody you had breast cancer. You didn't discuss it with your family. And next thing you knew, you had a mastectomy and you went on with your life, hopefully well, maybe not. And in the 1970s, mid-70s, late 70s, with President Ford's wife, Betty Ford, she had breast cancer. And so initially it was a week. And it was really aimed at the individual woman, not so much men at that time, but to just, we gotta talk about this, and we gotta get our mammograms, and so that was the goal. And it evolved over the years, and at this point, it's part of every fall, and it's a wonderful thing.
It's a good thing.
And it's a celebration for survivors.
Right.
It's a resource in every community for women to get their mammograms and get screened. There's even a men's breast cancer week now.
That's important.
Since 2021.
Let me ask you something real quick. Are there risk factors where people can assess themselves?
The whole risk factor thing is also really important, because risk factor basically says, what are the things that set me up to get breast cancer?
Yeah.
And there's a long list of issues. But I tend to ask people to do a couple of things. Number one is separate them into the things that we can't change,
yeah,
versus the things that we can change. And also really delve into your family history and know it, share it with your family, understand it, and sit down with your doctors. For a woman, sit down with your OBGYN, sit down with your primary care physician and say, look, I want to put my risk in some sort of perspective. I want to understand.
Right.
And so, for example, if you look at the category of things we can't change, we know that breast cancer is more frequent as we get older, as we get into our mid-50s and get older. Well, you can't change how old you are.
Right, right.
And just because you have a risk factor doesn't mean you're going to get breast cancer. But the better we understand our risks, the better off we are. We can't change who our parents are. So I could inherit a gene from my mother or a gene from my father that sets me up to get breast cancer or any number of cancers. The more we know about our own history, and the more we have these conversations with our family and the more we have these conversations with our doctors, the better off we'll be.
Yeah.
So with that in mind, let's talk about the guidelines for screening, whether you're at risk or not.
The guidelines, there's a number of organizations that have their own set of guidelines, and I try and just make it simple. Mm-hmm. That certainly by the time a woman is 40, she should be getting a mammogram and doing it on a regular basis. We can argue about whether that's once every 2 years until you're 50, and then once a year, and so forth and so on, but clearly by age 40, if you're high risk, and we can talk about some of those things, or if you inherited a gene, or if your mother died at age 30 from breast cancer, for example, we might have to start much younger. But certainly when a young lady is in her 20s, they should begin to become aware of their own breast. One breast may not look the same as the other breast, the feel of their breast, and so that when they change as we get older, you're right on top of it for yourself. And high-risk women probably need to have an examination by a healthcare provider in their 20s once or twice a year, and certainly once a year once they get older.
So are there any common misconceptions about breast cancer?
Oh, how much time?
Oh my goodness, you come up with a list, didn't you?
Well, I think the key is to understand that nothing is the same as it was 15 years ago, 10 years ago.
Yeah.
Your phone isn't the same, your car isn't the same. So what we know about breast cancer is not the same, and how people do is not the same. So a common misconception is that breast cancer is one disease.
Okay.
That this woman's breast cancer is the same biology and plays out the same as mine. And so she looks like she's not doing well, so I'm not going to do well. Your high blood pressure doesn't have to be my high blood pressure.
Right, right.
I'm sorry that man had a stroke, but that doesn't mean I'm going to have a stroke.
Right.
And so I think it's a misconception that we really don't quiet ourselves and just get the facts about your particular case and your particular family. It's also a scary diagnosis.
Yeah.
And nowadays, the point of screening, the point of self-examination is to catch it early when it's curable.
Yeah.
Period. But we don't go into it with the attitude of, I'm going to be cured. We go into it with, I'm dead. It's a death sentence.
Yeah, it's over.
I'm gone. It's over.
So the best line of defense is to the
stay.
screenings and to see your doctor.
Absolutely. Absolutely.
Doctor, thank you so much for coming in. Dr. John McKnight with TidalHealth.
It's so nice to see you. Thank
Every
you.
time.